Thank you. So, good morning to everybody. Honorable Chairperson, Moderator, my dear teachers and colleagues. My topic is MIMI strategy in primary PCI. This is new to someone, even for me it is not so old. What does MIMI means? MIMI means minimal invasive mechanical intervention. This is a strategy in primary PCI. So what are the steps in PCI, including primary PCI? There are at least 15 steps in PCI, out of which thrombus suction is very much important and special in case of primary PCI. And stent deployment is not a minimally invasive, is a major invasive procedure. Otherwise, wiring, balloon pre-dilatation, post-dilatation, all are the mechanical intervention and called minimally invasive procedures. All the primary PCI are not the same. In some cases, simple wiring establishes the TIMI3 flow. Main aim of primary PCI or pharmacoinvasive or thrombolytics is to establish the flow, TIMI2 or TIMI3 flow in the infarct-related artery. Sometimes wiring only establishes the TIMI3 flow. Sometimes it needs thrombus aspiration, sometimes need pre-dilatation, and sometimes majority of the cases is stenting with or without post-dilatation. Even with all these, sometimes we fail to establish the TIMI3 or TIMI2 flow. So these are the example of some primary PCI. In first one, you say this is a complete heart block, inferior posterior AMI, dominant LCX totally occluded. Just after wiring, TIMI3 flow established, then direct stenting done. In other circumstances, young patient, where RCA was totally occluded, wiring fails to establish the thrombus, TIMI3 flow or TIMI2 flow. So we did the thrombus aspiration, and after thrombus aspiration, without any pre-dilatation, without stenting, established TIMI3 flow. And on the right side, you see, this is the relook angiogram after 3 days. The segment that wire occluded is bigger than the other segment of the artery, and patient remain all right without any stenting. So other cases, complete heart block, inferior MI, even after thrombus suction, and even after thrombus suction, there was TIMI 0 to 1 flow. So we keep the patient on integrin, heparin, and dual antiplatelet. And after 3 days, patient was in complete heart block. And with the TIMI on flow, patient's complete heart block recovered and 2:1 AV block remain. So after 3 days, the coronary becomes like this with single stent. Patient was all right. So thrombus aspiration, one of the minimally invasive procedure that is significantly important in some cases. So when thrombus burden is huge, patient is delayed arrival. And because technically 20 to 30, sometimes more than 30% cases of primary PCI slow flow or no reflow occurs, and that is due to distal embolization. Theoretically, thrombus